Hi, my name is Holly Jordan, and today I will be talking about spina bifida and how to accommodate it in the classroom. Spina bifida is a rare genetic disorder that affects 1 in 2,875 people born in the United States. It occurs when the spine does not close during the development of a fetus and causes a gap. The gap can form anywhere on the spine, and in some cases, it can cause a fluid-filled sac to be on the outside of the body. Spina bifida is diagnosed during the late stages of pregnancy or throughout childhood. It can affect parts of the brain that controls executive functioning and can cause brain malformations. People with spina bifida can have difficulty walking or moving and may need the help of a mobility aid. There are 3 different types of spina bifida. The most common type is called spina bifida occulta. This is considered the least severe type, and this is when a small gap in the spinal cord, but there is no fluid-filled sac formed on the outside. This is considered a mild defect, and there are often little to no symptoms. Some of the common symptoms that do occasionally occur is back pain. Patients with spina bifida occulta are often diagnosed in late childhood or even adulthood since the symptoms are so minimal. The second type of spina bifida is called meningocele. This occurs when the gap in the spine does cause a fluid-filled sac to form on the opening of the spine. There are also very few symptoms for this type of spina bifida, but some of these symptoms can include bowel issues and sensory loss, as well as joint problems and scoliosis. This is the least common type of spina bifida, but it often needs surgery to put the sac back into the spine. The last type of spina bifida is myelomeningocele. This is when a fluid-filled sac with spinal cords and nerves in it forms on the outside. This causes a variety of symptoms. Every case is different and can affect different parts of the spine and have different symptoms. But the most common are weakness and loss of sensation in the lower part of the body and legs. Due to this, they often need mobility or walking aids to help them move around. Surgery is often needed for this type of spina bifida. This surgery can happen before or after the baby is born, but is not a cure, and any nerve damage already done cannot be fixed. This is also the most severe type of spina bifida. People who have spina bifida can have very different effects or none at all. Some of the most common symptoms are scoliosis, paralysis due to nerve damage, high blood pressure, since they often have trouble with their bladder and kidney. Swelling and scarring of the kidney can cause high blood pressure. Mobility issues, bowel problems due to the damage of nerves that control the bladder and bowels. It can also cause hydrocephalus, which is when cerebrospinal fluid accumulates in the brain. This affects around 80 to 90% of people with spina bifida. They can also have learning disabilities, as the gap in the spine can affect the brain's development. It can also impact their skin sensitivity and cause loss of skin sensation. It is also common to develop a latex allergy. There are a lot of symptoms that happen to people less commonly, but these are some of the most common. Living with spina bifida is not easy, and many children with spina bifida have challenges doing things in the classroom. Some of these challenges can include physical and mental challenges. Although adults with spina bifida have to attain an average IQ level, the disability often comes hand in hand with some intellectual disabilities. Students may have trouble with organization, memory, attention span, and perception. If a student also has a learning disability, which is common, they may also have trouble with math, reading, and language skills. Some of the physical challenges they will have in the classroom is mobility and getting around the classroom and school. Due to loss of sensation in the skin, they may not have the most legible handwriting, which can be difficult for both the student and the teacher. Lastly, since they often do not have control over their bladders, they will have to take frequent bathroom breaks or may have accidents which can interrupt the classroom. Although living with spina bifida is not easy, there are some things that teachers can do in the classroom to accommodate with this disability and make life a little easier. Here are some of the best accommodations for students with spina bifida in the classroom. One of the most important things for a child who has spina bifida and uses a wheelchair is making sure that the classroom is wheelchair accessible. The floor should be flat with no large rugs that may impede the use of a mobility aid. The classroom should also be kept picked up, and there should be no large or small tripping hazards on the floor that could make a wheelchair get stuck or potentially hurt a student. The desk for the student should also be big enough to accommodate for the wheelchair or walking aid, and should be in an appropriate spot that is easy to maneuver around. In the school itself, there should be ramps to make moving easy, as well as wide doorways to fit any type of mobility aid. Another important thing is the need for frequent bathroom breaks. Many people with spina bifida have severe nerve damage to the bladder nerves and can make it very difficult to tell when the bladder or bowels are full. It is important to make sure that the class has enough bathroom breaks throughout the day and that the student with spina bifida can have an unrestricted amount of bathroom breaks to reduce the risk of having accidents. Many people with spina bifida have their bladder emptied on a schedule, and some students may even have a catheter or stoma and should be allowed to go to the nurse when needed. It is important that students with spina bifida are given accommodations for testing, since many of the students may have learning disabilities. Many testing accommodations are set up through an IEP or 504 plan. It is important that a teacher follows the student's plan. Students can be given extra time to complete tests and assignments, as well as giving students the opportunity to use a calculator or laptop to complete their assignments. Students who have short attention spans or memory issues can be given multiple sessions or days of testing. They can also be given the choice to give oral responses to test questions, since handwriting things may be difficult. Or they can be given take-home tests to do outside of the classroom. Another accommodation for spina bifida in the classroom is having interactive technology, such as having text-to-speech or speech-to-text. Much of the interactive technology in the classroom depends on the school district and its resources. Some things that would be helpful in a classroom with a student who has spina bifida would be interactive whiteboards, specialized keyboards, and touchscreens. These can all help with mobility issues in the classroom with any associated learning disability. Here are 2 videos about accommodations in the classroom for students who have spina bifida. The first one is about wheelchair accessibility, and the second one is about the need for bathroom breaks. Spina bifida is a genetic disorder that in severe cases can cause loss of mobility in the legs. People affected by it often need the use of mobility aids or wheelchairs. Here are a few simple but effective ways to accommodate spina bifida and the use of wheelchairs in the classroom. An important accommodation is to make sure that the class is wheelchair accessible. As seen in this photo, there is plenty of space for a wheelchair to move and turn, as well as removable chairs that can be moved to make space for a wheelchair. This image also has a smooth surface, which is easy for a wheelchair to move on, as well as no tripping hazards like toys or cords on the floor. It is also important to make sure that there is a desk that can fit the wheelchair comfortably. All materials for the student should be easily accessible and on a lower level of the classroom. Those are some easy ways to accommodate spina bifida. People who have spina bifida often have problems with their bowels and bladder. Here are some helpful tips to help accommodate spina bifida and its bladder issues in the classroom. When you have spina bifida, you often can't control your bladder or your bowels, and so it is important to let students with spina bifida use the restroom as they please. This can help limit the risks of an accident happening in class. You can even make students a personalized hall pass to use. Ideally, a student with spina bifida would be placed in a classroom that has an attached bathroom, but that's not always an option. Ideally, a student with spina bifida would be placed into a classroom that has an attached bathroom, but in most cases, that's not doable. So, letting them use the restroom as they need to is a good example of how to accommodate them and their disability in the classroom. It is important for students with spina bifida to be included and involved in the classroom. They should not feel left out or secluded. To ensure they do not feel that way, it is important to accommodate their disability in the classroom to make this difficult disease a little bit easier to live with. Lastly, here is a list of the sources that I used for this presentation. I hope that you have learned a lot throughout this presentation and that you now are more comfortable with having a student with spina bifida and how to accommodate them into your classroom.